Hi, it's Michelle Turner from Movement Lesson, and I just worked with someone that had 6 valves done. And if you've never had open heart surgery, then hopefully you don't know what 6 valves is, and that's just fine. However, now a recovery obviously has to be done with your professional, your doctors, when's available for you, when you're good to go. But it's really important. What happens is they've cracked your chest open. Now that has to heal first, obviously, but you've got the sternum, you've got the ribs. What's going to start to happen, if it's allowed, is you're going to start losing that torque. And I'm going to keep my hands here. Your chest is capable of doing marvelous things, and when you're holding a pillow, this is how you have to get around. This is your protection. Your splint in a sense. For 2 weeks, it's your best friend. That's how you get up. But this is allowed to stay. I call it more of a wounded bird. But this is actually one of the best lessons you can start to do to get better. Again, as your doctor allows. And I have other things where you hug yourself, but that again is too severe because you're crossing the sternum. So it's just this gentle, and you literally, you might just want to go to the right and just ever so slow. Now I'm doing this in standing, sitting, whatever. Again, a couple of times and rest. And this might be a day's worth of work. I mean, just this little bit. You want the quality of movement. Notice how I'm not going, it's just this gentle. And as it gets better, I don't even have to lift my head up. But see how I'm starting to twist my shoulders? It's almost like if you close your eyes and you're just picturing dancing when you're like 17, or whatever. It's just that. But again, it doesn't have to be complex yet. And as you start to heal, you can start. This alone with a cracked chest is just, and look at me, I'm not doing much. It's bringing the chest from straight on to back. I'm not doing this whole thing, and that's fine. You might get there eventually. I'm just talking this, just allowing your body to know that this is safe, this kind of movement and gentle. Again, if you're like this, it's much more severe to keep your arms out. This is much more comforting. Eventually you get your arms away, but this is a very good way of protecting the sternum, feeling when you've gone too far, you don't want the strain, and allowing that to come out to do other lessons. So this is a really good thing to recover from open heart surgery and any other thing, trauma for the upper chest. Also just notice too, no pain, gentle. You can do this in bed. When I had a colon removed, I'm telling you, I was coming out of anesthesia, and it probably looked like I was having convulsions because I was just doing pelvic tilts and again, just minor. They eventually got into this where I can do, but if that's all I can handle under anesthesia, then that's all I can handle. But I'm moving. And I was out of the hospital in 2 days and fully recovered in 3 weeks. So it makes a big difference that way. But again, work with your doctor, work with, but if you wait and heal, per se, with no movement whatsoever, first of all, that's where you see this real, because again, the healing's happened and I haven't done anything for the torque of my chest. And the pain is very high. Now they want you to go work out, and that's where people fail. They start failing out because they can't handle the physical therapy, because again, it's like hitting that wall that I talk about sometimes, literally and figuratively. Thanks.